trying to show is intrusion. Do you see the lower left 5 that is supererupted? Do you see that? Also, do you see the upper left 6? You see that is extruded? You see that extruded? And actually this patient was referred to me by a dentist, and that dentist wanted to put implants for this patient. With traditional braces or aligners, how do we fix this problem? We have to put TADs, we have to do a lot of auxiliary movements to intrude these teeth. But what did I do here? I just placed the Brava. The anchorage here comes from, for example, for lower arch. While I am intruding the lower left 5, what is the reaction force? Where is the reaction force? The whole lower arch, right? Because that arm is connected to the anchorage base. While I am intruding that lower left 5, I'm going to extrude the whole lower arch a little bit. And it's not clinically significant. So I don't have to put a TAD here to intrude the premolar. The same way for upper left 6. You see the upper left 6, if just I put a Brava there, while I was intruding that upper left 6, I extruded the whole upper arch a little bit. But clinically, it's not significant. You don't even see that, right? So that's how efficient this is. And again, think about braces. If you put braces on the lower arch, when you're intruding the 5, what happens to the lower left 4? Gets extruded, right? It's so hard to fix that. But with Brava, the software looks at all the forces, the force pattern, and does all of those things for you. So here, just you think about the visual treatment planning, and you put the Brava in, and everything will be taken care of after that. Okay. Severe rotation. Do you see that upper left 5? You see that upper left 5? That upper left 5 is severely rotated. So in this case, I had to do a refinement. So after I rotated that 5 a little bit, later on, I had to do a new refinement, and I have to repo that bracket. So if you have like crazy rotations and stuff, you can still treat these cases too. But you might have more than one Brava. You have to go to the second Brava. You have to repo the bracket. And this is the lateral view for this patient. You see that upper left 4. We derotated that, and also we brought that canine that was tipped. We brought it into the arch, and the patient is class 1 on the left side. Okay, here is like the interdisciplinary case. I actually showed you this case before. This patient wanted to do veneers, although this patient has not done the veneer yet. It's just a composite veneer for now, but later on he is going to get the veneer. But I wanted to tell you about the interdisciplinary cases. With interdisciplinary cases, when, for example, a patient has perio problem, when the patient has like restorative implants, something that happens when they refer those patients to the orthodontist, sometimes these treatments take a very long time. For example, you want to put an implant there, and then the dentist sends the patient to us. It takes like 2 years and a half, 3 years, and the patient, the general dentist might lose that patient. But if you treat that patient quickly with Brava, you can refer the patient back to the general dentist. So I see a lot of referrals by the general dentist just because it's way more efficient. Here is a case actually I showed you before, but in 12 months we could fix the deep bite. The patient was class 2, we fixed the class 2. This is the case that I showed you. Upper centrals had lingual crown torque, and I fixed the torque for the upper central. So we fixed all of these things in 1 year. If you wanted to do this with traditional braces, probably it would have taken, 2 years and a half or something like that. With aligners, probably we couldn't even fix all these problems. But with Brava, we just put it there very quickly. We got them fixed. Or this is another case. It's just a 4-month progress. This patient really wanted to do the composite veneer at the beginning of the treatment because it really bothered her. And you see, after 4 months, we were able to get the patient to the point that we can put like some temporary composite veneer there. From an interdisciplinary point of view, when you're working with the periodontist, when you're working with the periodontist, when you're working with other maxillofacial surgeon, for example, like if there's an orthodontic surgery or something like that, you can fix those things very efficiently, very quickly. Or, for example, this case, upper laterals are missing. Upper right lateral is a baby tooth, and for implants, you can, we decided to distalize the canines and make room for that lateral, for those laterals. For the future, for now, we wanted to put like some temporary laterals, and then later on we put an implant for this patient. Again, I show you how efficient the treatment is in this case. This is a very quick treatment, and we put actually here in the panel. With this, upper laterals are missing. We have the upper right baby tooth, and here we were able to distalize the canines and make room for those laterals. And then we make the patient ready for the general dentist to, put the crowns there for now. And later on, the plan is doing implants for this patient. And actually, let me go back. I show you this is the final occlusion. You see, the final occlusion is very good in a very short period of time. Very efficient treatment. How about periodontal problem? When sometimes doctors ask me, this patient has perio problem. Can I treat this patient with independent movers? The answer is absolutely yes. Maybe the best choice when the patient has perio problem is independent mover. Why? For example, let's say you have an upper left lateral, the root is short, and you don't want to apply too much force to it. With traditional braces, we have ways to do it. We can't put like a piggyback, we have to bend wire, we have to do something. With aligners, we don't move that tooth that much, or if you move that, we can somehow do it, but we have to do something extra. What with Brava, just in the instructions, you can say, decrease the forces and moments for that upper left lateral. That's all. The force for that tooth will decrease. Or, if a patient has perio problem, for example, for the whole lower arch, or lower incisors, you can just write it in the instructions. Decrease the forces and moments for those teeth. And the software will take care of it. The forces and moments go down. Actually, I had a patient, actually she's an orthodontist herself. She has had 2 orthodontic treatments so far. Upper incisors, the roots are kind of non-existent. Basically, there is not much left there. But still she has posterior cross bites. She had. So, and we did Brava for her. We did Brava. We did a very good expansion. We did not even bond the incisors for her. That's totally possible. We didn't even bond, just we did the expansion, and she's an orthodontist. She didn't even use any elastics, or we didn't do any surgery, or we didn't use Marpi or pads or anything. Just with Brava, we were able to do the expansion for that orthodontist very efficiently. Okay, I think I have 1 minute, right? 1 minute. Okay. Okay. So, for example, this is a perio patient, and we were able to treat this patient. Some of these teeth are compromised, and the bone around them there's not much bone around those teeth. So we decreased the force of the moments only for those teeth, and we were able to treat this patient. Or this is another case. This patient had perio problem, so we had to extract the lower incisors. Lower incisors in general here are very compromised, but with Brava we could treat this patient. We extracted that lower incisor and we closed that space. And all of this has been done with only 1 Brava. We didn't have to really bother with any piggyback or any thinking about what. Just we knew that this Brava has lower forces for those lower incisors. That's all. Okay, so I think I'm done. Thank you very much, everybody. After Dr. Naran and Dr. Kim's lectures, We're going to be available. Hopefully, if you have any questions, we can answer.
Thank you.